And it's really about 100 visits to every patient care coordinator when they're doing any sort of insurance verifications, billing, etc.
So that's your metric. So if you get is it 100 patients a week, or 100 patients a day?
100
What are you
a
talking
week.
about?
100 a week.
That's it.
Yeah, because think about
Okay.
it.
Okay.
If they're doing verifications, that takes time away from your front desk. And here's the other thing: you really should.
Okay. No, hold on. Let's stop here. Just so we. So your bench, because once again, when I hear about staffing, like because we run a lot of we run 400 or 500 clinics in our community.
Sure.
We look at a percentage of the revenue. Okay.
Sure.
So what I love about what we just talked about is like I've never heard anyone do it the way you were talking about, which actually I really respect and I love. So you're saying your benchmark is for every 100 visits a week, right?
Yeah.
It's like one one.
If they're doing verifications and authorizations as well, because you think about it, what is the primary role of your front desk if you're really looking at them? Your primary role is patient management. Right? And if I'm pulling somebody off of patient management to go do verifications and certifications and authorizations and cleaning clinic rooms, that I see a lot, the front desk has to go clean the rooms or do the laundry, you're pulling them off of patient management.
Yeah.
And what happens is you actually become more inefficient, right? There's a reason why we run at 95% arrivals and 96% conversions. It's not because my training is huge, but another part of that is if you don't have the proper staffing, your staff is pulled. And what's the thing that people don't like to do the most of? They don't like to have to manage patients and sell them. Like that's more difficult than going and cleaning a room or doing a verification. So you want to make sure you have enough staff that your primary post, which is handling patients, managing patients, preventing cancellations, answering your phones and converting people, that's your primary role of your front office staff. It's not all this.
I'm going to ask you a clinic, so if you have a big clinic, like you have a big clinic that does 400 patients a week, they're doing a couple of $1 million, it's very easy to have a split up roles where this person, all they do is do the phone conversation because they're the best, right? This person can do billing. This person can do all the insurance stuff, right? This person could do all the rooms and all the other stuff, right? Dealing with payment, because those are different skill sets, right? So what do you suggest for someone that is literally doing 150 visits a week, where you kind of have someone full time, and you're maybe on that tipping point where you need another person half time, do you recommend having focused roles or training both to do exact same job really well?
So that was me. That was our practice when I started with Mike 10 years ago. We were at 96 visits a week. We're now at roughly just under 500 visits. And honestly, that's where we started. We had one patient care coordinator and she worked from this hours to this hours, but we were open. We bookended it being still open and we didn't have staffing there. And that affects your practice. Not having enough staffing at your front desk will keep you you'll be missing calls, you'll be missing appointments, people won't be managed. So one of the suggestions I make for practices is, okay, you have your one full-time person. When you're looking to hire somebody and you can't afford that full-time person, first of all, get your metrics up. The higher your metrics are, the more efficient you are, the more you can afford more staff in your front, because remember the front are, they're not the money generators, but they are the ones that make sure the money generators are full, right? So I would look to hire somebody, Rick, that was willing to start part-time with the willingness and ability to expand to full-time and earn a full-time salary and position in your practice by showing you that they're willing to learn, they're willing to do the training, master the metrics, be successful. And so when you're searching for somebody and you're small, like we were, you find somebody that wants to start with you part-time but is willing to expand to full-time. Now you can do the reverse. You can go all in and have two people and train them up really hard and really fast, like I did as well in the past. And, you get your metrics up really hard and really fast and the money's there as well.
So I went through that too. And when you hire someone that's part-time, they're picking up a part-time job at another place, right? Let's be straight up, right? You know,
Yeah.
because unless you're someone that always just wants to be part time,
Sure.
you
I don't want
know,
a part-timer.
I don't want a part timer, right?
I don't hire part-timers in
Yeah,
any situation now.
so back to the situation where like like if I want to hire this person part time, they do a part time like job like maybe at another place,
Yep.
I'm competing with like this other person that wants to take them full time with the same message, right?
Yeah.
And so something that like, and so I want to bring it back to you, like because something that you talked about earlier was that like we're leaking so much money in the front,
Yeah.
right? Does it make sense just to bite the bullet and hire someone full time?
Yeah.
And once again, maybe that person they hire full time, their main job is just to close deals on the phones.
Yeah.
They do the outbound call, they do the inbound calls, and they could like work with him on scripting and conversion rates. And then the skills that you hire is very different from hiring someone that does billing or like intake and all that transactional stuff, right? So what's your thoughts about that, Dee? I love to hear your thoughts since you're the expert of front desk and sales training, right?
I look, I look at both sides of things. I totally understand the practice whose margins are so fine that they can't make that big jump to two. And let me tell you, my husband Mike, if he were on this call right now, would totally tell you. I had to like pin him down and be like, I am hiring two people, and I hired two amazing people, and I worked side by side and trained them up. That's again not necessarily what everybody has that ability as an owner or manager to train side by side, but it is very valuable. Number one, to staff your clinic, your front appropriately, because we spend so much time and money staffing our back end and our clinical end, but our front end is what really makes sure that our back end has somebody to treat. Hence, more money is generated for the practice. So it's not just about hiring staff, it's about training them up so that they have the comfort and the skills and the systems to manage your patients and be successful. So if it were me, I'd bite the bullet. I'd hire two people. I would get rid of